Well, thank you so much, everyone, for attending the session. We are finally in our third session of this webinar series of regional inequalities and left-behindness. And we're very happy to have with us Arndt Leininger. I'm sorry for the pronunciation, I'm very bad of this, but from Chemnitz University of Technology. And he's going to talk about today an also very important topic that we have also discussing in a very different perspectives from the other two sessions about electoral outcomes as form of discontent, which is also a very important topic. And more we have seen in the recent years how it has been used and has been seen as a sign of discontent from the people, and how it has been evolving also, not only from example from Europe. It started from UK and US, but has been expanded to other parts of the world basically. So without more introduction, I will let you the microphone. Thank you so much for accepting.
Sure, thanks for inviting me. Very happy to talk about what I think is a very fast-paced field of research in political science. Many people working on this. I'll be talking about several publications that have come out in recent times that try to link local infrastructures, and I have more to say in a couple of minutes what I understand by this term, to political outcomes. Most papers focusing, of course, something we as political scientists are very interested in, electoral outcomes. Moving on to my motivational slide, and I'm just need to check why the slides are not moving ahead. Maybe this has something to do with the screen share. See. This is very odd. So it does react. Okay, it's just slow. Sorry for that. Let's see whether it's moving on now. So this is a German media report. I'll translate it for you. There was a debate about the hospital reform, about the German hospital system last year. It's actually still ongoing. Germany is spending a lot on its hospital, not necessarily getting the best outcomes in the European comparison. There's been talks of specializing clinics, which also means reducing the number of clinics. This is not a debate that's particular to Germany, but also other countries are discussing how to keep up public infrastructures in times of declining revenue for the state, the increasing challenges of keeping up infrastructures, especially in urban places. This is really very annoying. Okay, let's see. So there's lots of discussions about this. Germany is the federal system complicating matters. I'll also talk about federalism later, because federalism always complicates the picture for voters, who in the end is responsible for providing certain services. I've spent past half year in Greifswald in northern Germany, in the state of Mecklenburg-Vorpommern, where this was also a very prominent topic, especially prominent maybe in this state, because this is a very rural and rather poor state, which is struggling in particular to keep up infrastructure in its countryside. Here's an example from Mecklenburg-Vorpommern. This is the state of Mecklenburg-Vorpommern, and you see the outlines within the map. You see they're delineating the municipalities in Mecklenburg-Vorpommern. And what you're seeing here on the map, the time it takes if, say, you have a stroke in one of these places, the time it needs to get you to a specialized medical facility for these kind of emergencies. And times range from being very quick in more urban areas, just below 10 minutes, to over an hour, which from a medical standpoint is highly problematic. So you see there's a disparity in the availability of medical supplies in certain areas. And basically, the question that I'm asking in this talk, and I'm providing some examples from research, is does this have an implication for politics and for how people vote in these places, that access to certain facilities, for instance, in this example, medical facilities, is unevenly distributed across a polity. Here's a quote. I translated that one, so I'll leave it to you to read it. So basically something like medical facilities, here there's a special needs kit, but medical facilities, other facilities, are very important aspects to people's quality of life where they live. In this case, might even prompt them to leave to somewhere else to of what they're finding is not satisfactory, or it might have influence on their political views and behavior. And that's the aspect we're interested in this talk. This is also something that's just actually explicitly mentioned in the political debate by certain actors, saying, look, you need to keep up infrastructures, and you can't really win an election on healthcare reform, but you might lose it on it, especially people in certain areas feel they're not getting their fair share of public resources. And the point of this talk is, what do we know from academic research on this statement, on this argument, in this case here, by a medical interest group in Germany? We have another example, and then we're done with all the German news clippings. A statement from Germany's largest union, labor union, is saying that investment in public infrastructure is a way to curb the rise of the radical right. Very bold statement, and in this talk we'll look into whether there's some factual basis to this political statement. All right, so let's move on. Let's talk a bit about definitions. What do I mean when I say local infrastructures? So this can mean a variety of places, and people have looked into different institutions, and we'll cover some of the papers that you see here. These can range from being decidedly public, 100% state-run, to private-run institutions, apart from regulation, no state involvement, no state financing. So we go from basically local public administration, if you need to register your car or get your passport renewed, to schools. Most of them are public in Germany. There's some private schools, public transport, usually public utilities companies. Train station is also semi-public in Germany, and the hospitals are usually privately run, but they heavily depend on the regulation in the German healthcare system and German public insurance companies. So the state has a great influence on the viability of a local hospital. And then we go to more private enterprises like local shops or sports clubs or even pubs. And a lot of these, or basically all of these institutions have been under pressure in recent years, not only in Germany. The state has to save money. Some places are losing, especially rural, the countryside, are losing people. It's more difficult to uphold public institutions. There's amalgamations of municipalities, trying to make public administration more efficient. Schools are closing in the countryside. There's a common complaint about getting around in the countryside. How good is public transport? How often does the bus run? Germany, as other countries, have seen a lot of closures of train lines and train stations in recent decades. And the same holds for all of these other institutions as well. So if we want to link these kind of aggregate level phenomena, does a place have a hospital or not, to this aggregate level outcome? Does it have an influence on the election outcome there? We always need to think about what's our theory? How do we connect these two things? And the connection in social sciences is always the actions of individual people. And this has been formulated very famously by sociologist Coleman, who I had ChatGPT put him in a bathtub because his theoretical model that you see on the left side is often, because of its shape, named a bathtub, or alternatively a boat. And basically what Coleman tells us is, well, basically you have some event on the aggregate level. So in our case, say a hospital closure, a pub closure, and then you want to link this to the election in this municipality. And you can do this empirically, but really to satisfyingly explain this, you need to go to the micro level, to individual people, and understand what they are doing. Are they perceiving that a hospital or school has closed? How does that affect their daily livelihood? And does that affect how they think politically about it? And then how does that influence who they vote for? So here one example would be, and there's a paper in this that I'll show later, if your local pub closes, the place that you usually go to meet your friends closes, that obviously affects you, or might change your outlook on the world if you don't get to mingle with your friends anymore, and in the end might affect your voting behavior. And it's this path with the fully written out arrows that is driving some correlation that we might observe at the aggregate level. In terms of mechanisms, there are several ways to kind of fill out the bottom of the bathtub, if you will. One mechanism people have worked on is the resources model. The resources model is a very popular model in political science for explaining voter turnout, meaning that people need the individual resources to be able to participate. So they need the cognitive resources to inform themselves about politics, reach a decision. They need the temporal resources to actually follow politics, and also on the election day, go to the polls. The resources model says, for instance, here in this paper by Cox et al., which is about hospital closures in rural America, they're arguing, this might be a bit particular to America, but the example carries over to other fields. A hospital in the US is often a primary care provider. So a lot of times, especially uninsured people in the US, go to a hospital, rather a local doctor's practice, for their medical treatment. Now, if a hospital closes, that means a lot of people in the local community have to travel much farther distances to seek medical treatment. Maybe also the quality of the medical treatment decreases because of the absence of the hospital that they once went to. So this means they have to spend much more time on their medical conditions, commuting to places. Maybe their general ability to move around in a community decreases. So their resources decline that would enable them to participate. Same would hold for, say, the local supermarket closes and you have to travel farther distances. Your life is just busier, and your life leaves less room for politics. If going to the doctor, going to the shop, seeing your friends in the pub always entails long travel times, there's less time to read the newspaper, talk with friends about politics, and actually find the time on election day to, which on the US, for instance, is on a working day, find the time to go to the polls. So argument here is, losing certain infrastructures leads to decline of political participation. So the mechanism is just whether people vote, whether they don't vote. The next three mechanisms I'll talk about try to link local infrastructures to people who still vote, who they'll vote for. The first one is an accountability mechanism, assuming a more or less rational voter who is, that's basically the essence of the idea of elections, right? It's an opportunity for voters to hold a government account, or in the terms of a famous political scientist, elections allow citizens to get the government to do what they most wanted to do and keep the government from doing what they least want them to do. So if voters observe a deterioration in their local infrastructure, they might punish the responsible incumbent for this. This is quite a demanding mechanism, certainly more demanding in terms of trying to link these two aggregate outcomes to each other than the first mechanism, because this accountability mechanism not only requires people to realize that there's been a decline, but they also need to attribute responsibility. Who's to blame? And I've already mentioned that Germany is a federal system. So in the US, many other countries, especially in the federal system, it's difficult to sometimes to pinpoint who's responsible. For instance, for a school, it's fairly simple. It's usually a local government. It's much more complicated for a hospital, even if it's a municipal hospital, because the viability of a municipal hospital also depends on state subsidies and on healthcare legislation at the national level. So really, who do you hold responsible is sometimes tricky. But before moving on here, the general expectation here would be if people are able to attribute responsibility, you would see a decline in the vote share for the incumbent party, which would be made responsible for an undesirable change in local service provision. So it really depends on the governing studies of the party. It could be the Social Democrats if the Social Democrats are in government in a certain municipality. It could be the Conservatives if the Conservatives are in government at the local level at that time. So it doesn't really, it's not an argument about any specific ideology or brand of party. Really, it's an argument about who's currently responsible. And as I said, it's a demanding mechanism. So a much simpler mechanism to link infrastructure decline to political outcomes. And you can also see that it's much simpler, and it's simpler to find evidence here by the number of sites, and also because obviously working in a populist political right is very popular in political science. This argument is voters don't necessarily need to pinpoint the responsible party. It's sufficient that they say, oh, look, this is something that the state, whether it's the local or national level, has some responsibility for. And the state is deserting us by closing this infrastructure. So it's these elites at the top that are to blame, basically mainstream parties. This is a narrative that right-wing populist parties are often fueling, saying it's the elites, all the money is going to the cities, there's no money for rural infrastructure, so vote for us to show those at the top that you're dissatisfied. And so those papers would link local infrastructure decline to a specific political branch, specifically the populist radical right. So these three mechanisms rather directly link infrastructure decline to politics. There's a fourth mechanism, which I think is the most interesting one, but also the most difficult one, so there are not that many publications yet. And this is about understanding the roles of certain infrastructures have in people's lives and the effect they have on the general outlook in life, politics. The particular argument here followed Sociocultural Decline by Diane Bollet, who was the first one to publish something on this, is she says, one important aspect of these local places, and she focuses on pubs specifically, where the main function really is allowing a local community to mingle. And she says, pubs off the high street, so within residential areas in the UK, are places where white working class people meet and meet their friends, talk, and kind of uphold a sense of identity and pride in who they are and feel active members of the community. And if these places close down, this leads to feelings of isolation and being threatened by the general developments in society, which populist radical right parties with their messages then can capitalize on. Another mechanism might also be that a lot of these pubs will not be purely frequented by a very specific section of the community, but people of all walks of life will meet in there. So another mechanism will be that people in these places will be will encounter a lot of different viewpoints, outlooks in life, people with different backgrounds. Basically, they'll encounter a more varied set of opinions than if they just meet up with their friends at a friend's place. And they will have very similar opinions, as opposed to somebody might meet somebody of a different opinion. So these are the kind of the four theoretical mechanisms that political science has explored so far, and I'll just give you some insights now on how this has been empirically studied in politics. To give you a little prelude, I've already talked about the macro level and the micro level, and this is the theoretical model, and so empirically, you could look at a bunch of different relationships. Number one, I apologize, this is mislabeled below the figure. This is macro. So you can just get some data on, did a pub close in this area recently, or how many pubs are there, and you get the most decent election results in this area, and then correlate these. You can try also to do this over time. I'll have more to say about causality in a bit to get a more causal approach, but you don't really know what's happening at the individual level. So another thing that people would look at into the literature is a macro-micro relationship. So your independent variable is at the aggregate level, but you're looking at individuals. So for instance, you're merging some aggregate level independent variable to a survey data set to investigate these relationships. So you could focus on some intermediate step of the whole thing. So for instance, do people living in an area where pub closed, do they report a decline in a number of social interactions they have? That would be kind of this arrow A here. Or you can kind of do a shortcut and go directly from the aggregate level phenomenon to the individual level outcome. Look at, do people who live in an area where pub closed vote differently than people in areas that still have their pub intact? And the last aspect you can look at is the micro-micro relationship. So for instance, what do people report about the individual behavior? How is that linked to their political behavior? And different papers do different things. So some papers look at aggregate level relationships. Some papers look at micro-micro relationships. Some papers look at micro-micro relationships. Very strong papers, I would say, try to look at multiple of these paths to get a full picture, to kind of sketch out the full bathtub or the full boat, whatever term you prefer empirically. There's some challenges in this, obviously. If you do macro, that doesn't necessarily imply that the same thing is happening at the individual level. Well, usual example is there's a strong relationship between the local unemployment rate in a place and turnout in elections. But that does not necessarily imply that unemployed people participate less. The unemployment rate rather tells you something about the living circumstances of everyone in a place, whether employed or unemployed. The same goes for the reverse. So if you find some correlation at individual level, when you're aggregating these measures, it doesn't necessarily imply that you'll find the same correlation at the aggregate level. In political science, we are very particular about causality. So oftentimes we try to not just have a geographic element, looking at differences in places, but also looking at changes over time. Because if you look at something only cross-sectionally, oftentimes you can't really tell whether your X temporally preceded your Y or whether it's the other way around, or whether your Y, your dependent variable, is actually causing your independent variable X. So generally, as I'm sure you know, causality requires a cause precedes consequence, and you can observe empirically some correlation between cause and consequence, and that you can, and that's the trickiest part usually, you can exclude alternative explanations. And the papers that I'll show you on the next slides try to do precisely that. So on the resource model, I've told you about the theory. Cox et al. Say that hospital closures have a negative impact on the health of a local population. They increase the time that people need to spend on other things than politics. They also lead to increased unemployment in the area. Doctors are unemployed or they're leaving to other places. The diner opposite the hospital would also probably close because no one will go there anymore during their lunch hours or dinner times. And this all leads to a decrease in voter turnout. These are their hypotheses. So the hospital closure reduces the likelihood of affected individuals participating in elections due to increased participation costs. So in the hypothesis already, they'll be doing a macro-micro relationship. I have some phenomena at the macro level, the hospital closing, and they look at individual people's behavior. And I say especially voters with fewer resources that will be affected by this because they're more likely to rely on a hospital as a primary care provider. So what they have is data on hospitals. These are the dots. And these are hospitals that closed, and then they can calculate the distance that people live to a closed hospital. So if you're close to a closed hospital, you're affected. If you're close to a hospital that stayed open, you're not affected. And what they're doing is something that's very particular to the US. I always envy US colleagues for this. Some states have voter registries. So you have an individual level list of whether people in a certain area turned out to vote or not. So they can really relate that to individuals. And they also have the information in these voter registries. They don't have people's names, but I have whether they're registered as Democrats or Republicans. They have age bracket, and it can also proxy their income by where they live. And so one thing they can show is that these hospital closures affect a poorer democratic audience, if you will, that segment of the population, which kind of is a bit ironic because this is hurting the party that stands most for keeping these hospitals open. Another thing I should mention is they do some checks, right? These areas are not ex ante different. So if you're comparing outcomes when in places where the hospital will close while it is still open, there's no difference. There's only a difference after the hospital closure. Somewhat reassuringly, this is not a long-term effect, but if there's an election in like half a year after the hospital closed, this will have a marked effect on turnout, so around 5 percentage points, which can make the difference between winning or losing for a Democrat candidate if it's a close constituency. So ironically, it's kind of self-reinforcing phenomenon of populism, because these hospital closures are due to basically the medical system in the US also being under stress, and Medicaid was expanded under Obama, under the Democrats, and states had to opt into this program. If they opted into it, there would have been more federal funding for their hospitals. And it was mostly Republican-led states that declined the Medicaid expansion for their state, meaning that hospitals in their state closed, which in the end, as you've seen the results before, ended up benefiting them because it's primarily democratic demographies that are affected by these reforms, and then as a consequence, they'll go to the polls. Now, in terms of vote choice, the other mechanisms, citizens must first observe a proceeding decline, interpret this development, attribute responsibility, change the vote choice accordingly. And people have studied this. For instance, Newholt, some of you might be able to tell by the name. This is a study by a Danish colleague on Denmark. This is now on schools and hospitals. So he summarizes this hypothesis by calling a school or hospital closure a political decision with negative local effects. And the accountability hypothesis would be that this leads to a decline in support for the responsible parties in the affected areas. And he also tests the dissatisfaction hypothesis, which would say that these political decisions with negative local effects benefit a specific party, a right-wing populist party, which they also have in Denmark. Again, what they're doing here is collecting data on schools and hospitals, and again, focusing on the closure of schools and hospitals and relating this to electoral outcomes in the area. This time, this is a macro study, so it's looking at outcomes within a municipality. And this is now result for the accountability mechanism. You see the label on the y-axis. This is the change in support for the incumbent party in a local election. So incumbent might be the Social Democrats, might be the Conservative Party of Denmark, depending on which municipality you're in. And if you're looking at P and P+1, that is the post-treatment period, so after school closure, you don't really see any significant differences in electoral outcomes between before and after school closure. The same more or less applies to hospital closures. So little evidence for an accountability mechanism. The results a bit stronger, maybe, if not significant for schools, which makes sense in the sense that schools are the sole responsibility for municipal council in Denmark. Whereas, as I explained earlier, hospitals are basically joint responsibility of a municipality and the national government, because the national government has a very important role in funding the healthcare system. What we do see, however, is an uptick in right-wing populist party support following such local events with negative consequences, both for school closures and hospital closures. So preliminary conclusion is that today, first of all, what I've shown you so far is mainly studies focused on public institutions, schools and hospitals. It focuses on developments that are largely beyond the control of local authorities concerned. Schools might be one exception, but local authorities don't really have control over their income levels. So at some point, they need to cut corners at some point in some institution. The focus is on the mechanisms of the resource model, government responsibility to satisfaction. Less attention is so far been paid to private services, so to local shops or pubs, and how these contribute to social capital of a community. I think that aspect is particularly interesting also because with the public institutions, the state responsibility is very clear, and beyond voting, voters have little influence on this. But every voter, as a consumer on the market, has an influence on the economic viability of private sector institutions like your local bakery, your local pub, supermarket, whether you have a post office or not. And also communities have a variety of instruments at their disposal to promote the establishment and the preservation of local shops. And that's where the theory of social cultural decline comes into play. And I will now briefly summarize the paper by Diane Bollet. And she argues that the loss of social cultural spaces increases an individual's tendency to support a right-wing extremist party. In her case, she's focusing on the UK. She's focusing on UKIP. At that point, when she did her study, it was still UKIP and not Reform. So again, a nice map and a very fine-grained localized data on pubs. Here again, it's important to differentiate between high street pubs that would be like on one of the main roads on the shopping street, also frequented by people out of town, and community pubs, usually off high street and more embedded in the local communities. What she's doing here is a dot for every pub that has closed since 2003. I mean, the UK still has a lot of pubs, but you see a lot of these places have closed in recent years. And what she does is she links this to panel data from the UK household survey and shows that among a specific segment of the British population, specifically the white British population, if a pub closes, a community pub closes in the vicinity of one of the respondents, so she's matching respondents to their closest pub closes, the individual's propensity to vote for UKIP increases. The mechanism, she argues, is that these local meeting places where people can come together as a community vanish, and isolation, feel of kind of status decline, areas, places that make up my community are vanishing. These make them more susceptible to the messages of the populist radical right. So to conclude, local infrastructure is political. A lot of it is provided by the state, but it also very acutely shapes people's perception of the livability of the area that they live in. And in the end of the day, many people hold the government to account for the general living circumstances, be it the state of the national economy down to the local level, the quality and availability of local services, from public to private. Closures also reduce resources of a local community. I mean, your life gets harder if the doctor is far away. You can't see your friends in the local pub because that is closed, or you need to travel further distances to go shopping. And attributing responsibility is hard, so the easiest reaction is to generally punish the political mainstream and go to the right-wing populist appeal. That seems to be the kind of most consistent result that we've seen in the literature across a number of countries. So it does not only affect public places, but also private places, as we've seen. And I think protecting these local infrastructures, even if it is costly, helps sustain participation, trust, and a democratic culture in places, especially rural places that are most hit by a threat of infrastructure decline. So here's the reference list. You can also share the slides, but also so the references are in the video so people can look into this. It's really all research published in some of the top journals in political science in recent years. So this is really a very prominent topic in my discipline. And I expect many more papers to be coming out in the future. There are also some working papers, as you see here in my reference list, that I didn't talk about in the talk, that also extend the focus, for instance, to train service. There was another working paper here. Where was it? Yes, also on public services. I know there's another one that also Kevin DeVries is working on general practitioners, so doctors in the UK. This is a very exciting and fast-moving research field, political science. And then I'm happy to open for discussion and questions. And also happy to learn how these aspects are discussed and studied in your field. So
Thanks so much. And it was super interesting presentation. I mean, I think it's up to date, as you mentioned, like more and more papers have been coming out related to topics from political science. I'm not very familiar with it, but also from economics, geography, because it's really a matter of space. I mean, I opened also the floor for questions. If you don't want to say it out loud, you can also write them in the chat. But meanwhile, I have a curiosity maybe if more specific context, for example, how this, I mean, it's just a guess. If this can be also different, for example, within cities in the process of gentrification, that is not just the closure of places, but the changing of them. For example, what used to be a local pub closed and now it's a restaurant, I don't know, whatever, for a different kind of people. So it's not a sense of abandonment, but also of displacement. So you're like, because I may imagine, for example, a closure in some other areas, for example, rural areas or the cities is just closure and that's it. But how it can be also reflected in some more urban context where it's just the change of it that is not belonging anymore to the community. I don't know, it's just a random thought maybe after this.
Should I answer straight away if you want to collect comments and questions?
Maybe there's I think we're gonna start discussion for now and then we'll wait for the rest to be brave to ask something.
All right. Something. Yeah, sure. I think it's a very good question, both on the conceptual theoretical level and the empirical level. On a conceptual level, this is maybe the kind of the counterpoint to what I was talking about, right? So an increase even maybe in the availability of certain facilities and places, like gentrifying neighborhoods in certain cities, right? This is something that's also been studied a bit, and I can share some insights on this. But it's generally also a problem, at least of political science. I don't know to what degree you think that's the case in your disciplines, that we often focus on the things that are going wrong and often frame it as loss of certain infrastructures. You can always, I mean, that's what's happening in a lot of places currently, is that there's less schools, less hospitals, but you could often also frame it positively in terms of what does a pub or what does a hospital contribute to a local community, rather framing it and studying it in a way of what does taking it away take away from the community. And empirically, the interesting thing here is that a lot of this research here that I've presented, it is at a certain level of aggregation, which often has to do with data availability, but it is certainly also interesting to look within municipalities. And of course, often this is easier done in cities than in the countryside, where this granular data is more available. And phenomena like gentrification are usually phenomena in urban areas. But there's some research on this. So research by colleague Tarek Abuchali did at Cohen on Germany. They are linking rent increases, which would be a sign of gentrification, to increased support of the AfD. At least in the short term. I mean, this is also both a conceptual and empirical problem. But at least in political science, and I know that same as is very true in econ, we're very much focused on causality, right? So we are often working with these time series or panel models, and to really get a causality, what we're always looking at is identifying short-term changes, right? And so, for instance, the Abuchali and Cohen paper showing us, at least in the short term, these rent increases, they're pinching people's purses. They're also a proxy of your local pub closing and being replaced by a third wave coffee shop, maybe, that you won't attend anymore. And then this is kind of a set of threat if you are a low income working class white person. In the short term, that might certainly be true. But as you said, in the long term, this might push out certain people out of the community. And then over the longer term, this place becomes a Green Party stronghold, maybe. And so I think it can be a curvilinear relationship, which, of course, empirically is much more difficult to study in a causal manner.
Thank you so much. Yes, Max?
Yeah, many thanks from my side. It was super fascinating to hear and see yeah, about your research and the insights from like a political science perspective. I think we as geographers and economic geographers are very interested in place. So regarding like the pubs, for example, I would be interested in if you can see in your data or in like the publications from the other authors, if there are like alternative places where the people formerly like going to the pub then reorganize and now are heading towards which then also like foster and drive this political shift. Thanks.
Yeah, I think this is a very good point, because if you think about places where the local pub or the local bakery or shop is already closed, it's very difficult to get somebody to reopen it as a private enterprise. They might be better off in terms of making this some community initiative, local association taking over, opening this place, maybe only for coffee and cake on a Sunday. I've recently been to rural Brandenburg, where such a place existed, and I think these things are really important for people to have a sense of community and not feel too abandoned. I think we haven't looked too much into this yet, at least in quantitative political science, because these kind of things are just much harder to measure. Like pubs, you can get from the registry of firms. These private initiatives are much harder to get at, but I think they're very important. And something that politics can do in certain places is try to encourage these kind of initiatives. This is not always easy. Now, so my impression is depends on under the local culture, and this is now a bit of anecdotal evidence mixed with some hard data, but also at a very, very good level. So the anecdotal evidence is that in rural southern Germany, close to Freiburg, where my grandmother used to live, some local town, they didn't have a pub or anything anymore. They didn't have many things there anymore, but they did have one old storefront that was rented by a few local people, and they would only open it up to the local community on Tuesday evenings, and then people would go there, have a beer, and chat with each other. And obviously, that place would still have much more community, a better sense of belonging than a place that doesn't have that. But the difficulty really is it takes the initiative of people to do this. And when we're talking about Germany, Eastern Germany is much more rural, right? Also because a lot of people left following reunification. And so a lot of places, the rural countryside, the countryside in Eastern Germany has less of this infrastructure than the Western rural area. I mean, Western Germany, like the rural areas, they all have these Feldmarktführer and some obscure product you never have heard of. And so they're relatively wealthy municipalities with still some infrastructure. And my impression is the mindset in Eastern Germany is a bit different. Having lived, a lot of people having lived under communism, where everything was state organized. The sporting club, the crash for the kids and everything was organized through the local companies. It's not that initiative or this tradition of private initiative to compensate for something that the state is not doing. And to add some evidence on this, I've looked into some data for my project on sporting associations. And what was surprising for me to see is if you look at the number of sporting associations per capita, I was surprised to see this is one of the very few socioeconomic statistics that you can look at, like on a map, say county or municipal level, and you don't see the inner German border, right? If you look at unemployment, average income, age distribution, or whatever on a German map, at a county level, at some disaggregate level, right? You usually see the outlines of the inner German border. You didn't see this, interestingly, for sporting associations. But if you look at membership in these associations per capita, you see the border again. So this kind of initiative to participate in collective undertakings seems to be weaker in Eastern Germany. Now it'll be a problem for starting up privately run alternatives, communally run alternatives to infrastructure.
I don't know if we have time for the last question that is in the chat from Luis Coben. Many thanks for this great webinar presentation. While I'm not disagreeing with the conclusion with this argument, I was wondering though about the role of individual perceptions and individual level social capital in relation to the broader contextual factors you discussed. How might disentangle these effects help us better understand voting outcomes and, in particular, expressions of discontent? Do you have any comment on this?
Yes, I mean it's not apparent in every study, right? It's basically impossible to get at what subgroup of the population is affected if you just have aggregate level data, macro relationship like Nieholz, right? Or it's just on a fine-grained level, right? Municipal, or I think even precinct within municipality. It's still groups of people. But some of the studies I've shown you, the US study, it was not survey data, but with these voter registries, but at least gave you an idea about the walks of life people were coming from, were they leaning Democrat or Republican, how old were they? And with the hospitals, you could really see it was a poorer, older population, more dependent on hospitals and primary care provider, being dependent on this. If you could do a similar thing, and then Bolle actually did this, right? So he said, white working class population. I would also argue if she divides up her sample and interact up closure with middle-aged men, the effect for middle-aged men would be much stronger than for middle-aged women or older women, right? So it really depends on which demographic is reliant on these places. And some places might be very specific to a certain subgroup of the population. So for instance, pubs. A hospital, just by its size, is relevant for the whole community because it provides employment to a lot of people. It provides employment to people's spouses. It provides customers to people who work in a hospital or customers in shops nearby. So it has a follow-on effect. A school closure affects children and their parents, but not if your children are already out of school or you don't have any. So really, it's always worth thinking about which demographics are affected, or might be more narrow, might be broader. And even there might also, it's also important to take into account that, and this is something that also has not yet been looked into in the literature, is that these places have a function for you, even if you're not frequenting them yourself, so are not dependent on them for your income. So this is another anecdote from Greifswald. As Max might know, a local bakery in Eldena, this is a suburb of Greifswald, close to the sea, recently closed. And that was on a headline of the local newspaper. So I figure he had problem of finding somebody who would take over the shop, but I figured people also thought this is economically not so viable because most people nowadays, they go to the bakery in the supermarket when they get the groceries to get the baked goods. So oftentimes this is a change brought about by the consumption behavior of the local people themselves, but still the local bakery going is a decline in their pride in their municipality. Their municipality is suddenly less relevant because they don't even have a bakery anymore, even if they themselves are partly to blame because they most often get their baked goods from the supermarket. So I think that the symbolic relevance of certain places to people is also underexplored.
Thank you so much, Arndt, for this amazing session. We know that we need to close now, and also thank you again. Thank you all for participating, and for sure the Young Scholars Initiative and the Regional Studies Association. And we will meet next month in November 12th for our last session, that is in Policy, Perception and Place. So we will see you more or less in 1 month, and thank you all for coming, and see you around.
Thank you all. Thank you for the discussion. See you around.